Hi, hello everyone. Welcome to Dr. Ravichandra Official. In this video, we will discuss instruments that are kept for undergraduates in their final examinations for Viva and as spotters. Let's start the video. First instrument is urinometer. It is used to measure the specific gravity of urine. Normal specific gravity of urine is 1.0052 to 1.025 and fixed specific gravity is 1.010, where the kidney is unable to dilute or concentrate the urine. So fixed specific gravity is seen in renal failure. The markings on the urinometer will be 1.000 to 1.060. Albinometer. This is a glass tube with markings U and R. U stands for urine and R stands for reagent. From the base up to the mark U, the you have to take the urine and then you have to take the SBAX reagent. The tube is graduated from 0 to 12 in grams. This is used for the quantitative estimation of albumin in the urine. Heuristics reagent strips. These are used for testing the urine. Each strip tests for many important markers like glucose, nitrates, leukocytes, proteins, etc. The test results will show information pertaining to the kidney status such as urinary tract infection, diabetes, or any kidney disorder. Improved Newport chamber. Uses are it is used to measure the RBC count, WBC count, sperm count, and absolute eosinophil count. And it is also useful to measure the platelet count also. RBC pipette. It is used to measure the RBC. The bulb is there in a RBC pipette with a red bead. The markings on the RBC pipette will be 0.5, 1 and 101. So the dilution factor will be used is 200. This RBC pipette is used for measuring mainly RBC count. Sometimes it can be used for sperm count and for high WBC count such as in leukemias. WC, WBC pipette. It has a bulb and it has a markings 0.5, 1 and 11. The dilution factor will be 1 in 20 and it has a white bead in the bulb. Uses of a WBC pipette are it is used to measure the WBC count and various body fluid cell counts like CSF, pleural fluid, ascitic fluid, and it is also useful to measure the sperm count and platelet count. Hemoglobin pipette. It is a slender special pipette with a single mark of 20 cubic millimeters or millimeter cube. It is used for quantitative estimation of hemoglobin in the blood using Sahli's hemoglobinometer. Westergren's pipette. It is of 30 centimeters length with a bore diameter of 2.5 mm and it is used for erythrocyte sedimentation rate. It is more accurate than the Winthrop's method. And this Westergren's pipette will be having the markings from 0 to 200. The anticoagulant used is trisodium citrate 3.8%. Winthrop's tube. It is a tube with opening at one end. It is about 11 centimeters in length with a bore diameter of 2.5 mm and it has markings 0 to 10 from top to bottom on one side and 10 to 0 on the other side. It is useful to measure the ESR, red markings from top 0 to bottom 10. And it is useful to measure the PCV, white markings 10 at the top and 0 at the bottom. And it is also useful in preparation of a Buffy code. LP needle or lumbar puncture needle. It is useful for CSF examination. CSF is useful in diagnostic and therapeutic. So CSF analysis is done for meningitis, subarachnoid hemorrhage and spinal tumors, and it is also useful for therapies like chemotherapeutic drugs and radiographic drugs are induced into the body using these LP needles. Coming to the bone marrow aspiration needle, there are various bone marrow aspiration needles, Clima needle, Sala needle. This is a picture of Sala's needle. It has needle, stylet and guard. The guard with screw is represented by yellow arrow and the stylet with red arrow and needle with blue arrow. The name itself is indicating that it is useful for aspiration of the bone marrow. Jamshidi needle, it is a bone marrow biopsy needle, and bone marrow biopsy is done at the posterior superior iliac spine, anterior superior iliac spine and spinous processes of the vertebrae. In infants, it is done in the upper portion of the tibia, that is tibial tuberosity. Liver biopsy needle, it has cannula, stylet and bifid needle. Uses are, it is useful in the evaluation of the jaundice like viral hepatitis condition, liver cirrhosis, and it is helpful in typing the liver cirrhosis and its progression, and it is also useful in storage disorders like glycogen storage diseases, hemochromatosis, Wilson's disease, and it also useful in evaluation of neoplastic lesions, primary and secondary. It is also useful in knowing the pyrexia of unknown origin because of TB or sarcoidosis or leishmaniasis. Contraindications are high dilated cyst, obstructive jaundice, and bleeding disorders, prolonged PT. Coming to the vaccinators, red top vaccinator, it has no anticoagulant. Blood clots after contact with the glass and separates serum. It is used where in serological tests like LFT, liver function test, renal function test, lipid profile, and thyroid function test. Blue topped vaccinator consists of citrates. It is also called as citrate tube. It contains 3.8% trisodium citrate in liquid form. It is useful in knowing the prothrombin time, activated partial thromboplastin time, and thrombin time. And it is also useful in D-dimer test. ESR estimation by Westergren's method can be done using a black topped vacuum. EDTA tube, ethylene diamine tetraestic acid tube. It is lavender topped or purple colored top. It contains EDTA, which will chelate the calcium and helps in anticoagulation. Use It is used in hemograms, platelet counts, and reticulocyte counts, and even in hemoglobin electrophoresis and HbA1c determination. Fluoride or glucose tubes will have a gray topped vacuum contain sodium fluoride and potassium oxalate. Fluoride is an inhibitor of glycolytic enzyme enolase. So fluoride tubes are used in measuring the blood plasma sugars. In blood donations, we will use bags. So this is a plastic bag for blood collection. It contains anticoagulant CPDA. C stands for citrate, P for phosphates, that is sodium biphosphate, D for dextrose, and A for adenine. It is used for blood collection. Iris spatula. Iris spatula is a wooden spatula used to collect cervical cell samples for cytological examination. It's used during gynecological examination. And this iris spatula is helping a lot in screening the cervical cancers. It has a concave end to fit the cervix and a convex end for vaginal wall and vaginal pool scrapings. One end is longer so that spatula fits the external os. Samples are collected by 360 degrees rotation. Leucart mold or L mold. The spelling is Leuckhart. A first phase. In few books, it has been written as LeuckhRts. These are metal molds used for embedding and blocking, making with molten wax in the tissue processing. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos.